एक्सपर्ट्स ने कहा है. So we've got Dr. Koulshan and Jameel Mustafa, consultant in Obstetrics and Gynaecology at the Medcare Royal Specialty Hospital with us right now. Good morning, Doctor, and welcome to Talk 100.3.
Good morning.
So there were two reports. Let's start with the first one. The noise pollution and loud sounds and stress, of course, impact the fertility rates both in men and women. Your thoughts, doctor?
Of course, any stress, it will affect any type of disease in the life. Because of the stress, we release certain hormones. We call stress hormone is cortisol. It will increase chance of diabetes, hypertension, and even changes lead to imbalance of the hormones in the body, estrogen and progesterone in the female and testosterone in the male, so interfere with the ovulation and interfere with the sperm production, so it will affect the infertility.
Right. So what are those stress management techniques that couples can actually try to conceive or probably incorporate in their daily lives when it comes to exposure of sound and stress in their daily lives?
Any stress, it will need some change of our lifestyle, because the stress, if we know the stress, it will be lack of sleep, effect of our diet, it will affect our exercise. So all these will affect our life. So in other way, how we treat all this, first, we need to have little relaxation therapy, meditation, yoga, deep breath. This will help. Second thing, we have to go to the counseling. Some therapists who are specialists, especially in infertility, for the counseling. The other thing, we have to arrange our lifestyle, like exercise, proper diet, good sleep, and lastly, we will go to the group therapy. Some group therapy or supportive therapy, either friends, family, or sometimes we can go even to the people who have gone through all these things and they have good and successful outcome. If all is not successful, we have to go to the specialist like psychotherapist or psychologist.
Right. Now, moving on to the next report, which said that 60% of adults have at least one chronic health condition. The experts have pointed this out, and the common deficiencies which we all have is iron and vitamin D. Now, 60% is a huge number, more than half of the UAE adults, Dr. Koulshan.
Yes, yes, of
So,
course, because, yeah, tell me.
why do you think this is happening with all of us?
Vitamin D deficiency, especially because if we are in hot area, nobody is going outside, nobody is going to exposure to the sun, because the main source of vitamin D is sun, and not exposure to the sun, and because there is no proper walking outside, or even our exercises indoors, workup is indoors. Second thing, the iron deficiency, because the iron absorption will decrease with certain things, like we are taking excessive tea, excessive coffee. It will decrease absorption of the iron. So our eating habit will affect also the iron absorption. So that is why we have iron deficiency anemia or vitamin D deficiency.
So when it's chronic health conditions, it's not only cardiovascular, it's also, as you mentioned, iron deficiency, insulin resistance, hormonal imbalances that actually disrupt our daily routines as well. Now, I'm sure that, during workplaces, a lot of stress comes from there as well. You think any stress reduction initiatives can be given to promote employees' well-being in the workplace?
Definitely, there is a workplace, especially in UAE, there is the things of the employee well-being regarding their mental health and proper counseling, or even in our Medcare we have a leave, which is well-being leave. that they think about the prioritized life balance and include the boundary of the work, personal life, engaging in hobbies, regular prioritizing self-care, exercise. A lot of things will help to decrease the work stress.
A lot of individuals, they fail to recognize these symptoms in their daily lives. For example, there is a lot of breathlessness that happens while walking up the stairs, or there are some joint pains that happen after sitting. And a lot of individuals go to the pharmacy and get the medicines without consulting the doctors. Is that the right approach, or it could work at times?
Of course, no. We have to go to the specialist or the one who is the diagnose what is the cause. It might be like only like the psychosomatic. If I'm not happy. If I have any stress, I might have backache or joint pain or whatever I have, and they give me medicine. I have to go to diagnose if there is really is a somatic cause or it is only psychosomatic, and accordingly I have to take the treatment.
Right. And also, to end this interview, some effective coping mechanisms for all of us who are dealing with stress related health issues?
Of course, I would say there is some related mechanisms. As I said, we have to relaxation, yoga, meditation, fun activities that improve our mental health and emotional well-being, and maintaining, of course, open communication with each other and our employee. They have professional counseling that elevate stress and enhance our proper life.
Great, Dr. Koulshan. It was lovely talking to you. Thank you so much for all the insights and inputs. It was a pleasure having you this morning.
Thank you so much.